Hi, I'm Anne Herod, and this is our video presentation for mental health and illness focusing on selective serotonin reuptake inhibitors. This video aims to educate the audience on selective serotonin reuptake inhibitors. It addresses SSRIs, their indication for use, side effects, and the nursing role in their administration and monitoring. This video will benefit the graduate's understanding of SSRIs in strengthening your understanding of the SSRIs. Hopefully this will allow you to feel more comfortable and confident with your own knowledge and administering of these medications. So we have the types of selective serotonin reuptake inhibitor medications. Excuse my pronunciation, but there are several different types of selective serotonin reuptake inhibitors. They are most commonly prescribed antidepressant for easing moderate to severe depression. You will see these medications labelled as both the generic and brand name, including citalopram, which is Celexa, escitalopram, which is Lexapro, fluoxetine, which is Prozac, paroxetine, which is Paxil or Paxiva, sertraline, which is Zoloft, fluvoxamine, and vilazodone, which is Viibryd. The most frequently prescribed SSRI medications are Prozac, Celexa, and Zoloft. In the hospital setting, you will see the use of most of them when dealing with patients with anxiety or depression. 2. Basic mechanism of action. A simple overview of how the mechanism works. How does selective serotonin reuptake inhibitors work? Serotonin is influential on a person's motor activity, hormone secretion, autonomic function, emotion, mood, affection, and cognition. It provokes feelings of happiness and well-being. A lack of serotonin can lead to depression and other mood changes. Therefore, selective reuptake inhibitors increases levels of serotonin in the brain to ease depression, which is the feeling of sadness. Serotonin is a chemical messenger, a neurotransmitter, that carries signals between the cells of the brains. The SSRIs block the reuptake of serotonin in the brain, making more serotonin available there. The reasoning behind SSRIs being named selective is because they seem to not affect other neurotransmitters, only primarily affect serotonin. These SSRIs are also used to treat other conditions such as anxiety. Thank you.
Hi, my name is Jennison, and I'm going to talk about all the types of SSRIs we have available and what is the most common conditions that they treat. So I'll start with fluoxetine, which is used to treat major depressive disorder, obsessive compulsive disorder, bulimia nervosa, panic disorder, and premenstrual dysphoric disorder. They basically start from 20 milligrams per day orally for major depressive disorder and obsessive compulsive disorder, reaching a maximum of 80 milligrams daily. For bulimia, it's a continuous treatment for several days, and it's usually prescribed 6 milligrams orally. For panic disorder, it will start from 10 milligrams, and then it will reach a maximum of 60 milligrams. And for premenstrual dysphoric disorder, if it's a continuous treatment, it will start from 20 milligrams and will reach a maximum of 80 milligrams. Or if it's an intermittent treatment, it will start from 20 milligrams 14 days before the cycle, and then repeat the same dose every month. So with escitalopram, is used to treat major depressive disorder and generalized anxiety disorder. It starts from 10 milligrams orally daily for both of them, and it can increase also for both of them 20 milligrams after 1 week. With citalopram, it's usually used for depression, and it's up from 20 milligrams every day orally, and if needed, it can increase up to 40 milligrams a day after the first week. With fluvoxamine, we have treatment for obsessive compulsive disorder. We will start from 15 milligrams daily orally, And the dose, if the dose is higher than 100 milligrams per day, it should be given twice a day, and a maximum dose of 300 milligrams will be given. For paroxetine, we have the treatment for depression, obsessive compulsive disorder, panic disorder, social phobia, generalized anxiety disorder, post-traumatic disorder. It's used for various types of mental conditions. And it usually starts from 10 or 20 milligrams per day, and then it can increase up to 50 to 60 milligrams a day, depending on the condition. And sertraline, it's used for major depressive disorder, obsessive compulsive disorder, panic disorder, social anxiety disorder, and premenstrual dysphoric disorder. It is usually from 25 to 50 milligrams orally daily, depending on the condition, and it should not exceed 200 milligrams daily. For premenstrual dysphoric disorder, it's going to start from 50 milligrams a day if it's a continuous treatment or during the luteal phase, and a maximum of 150 milligrams when continuous, or 100 milligrams when during the luteal phase. Thank you very much.
My name is Selina Gaba, and I'll be talking about the major side effects of SSRIs. All SSRIs work in a similar way and generally can cause similar side effects, although some people may not even experience any. Most side effects are acute and diminish over days or weeks. The side effects include nausea, diarrhea, nervousness, agitation, and restlessness. Also sexual problems such as reduced libido and erectile dysfunction. We can classify the side effects according to the systems that they affect. The first one being the gastrointestinal system. Stimulation of the serotonin receptors located at the hypothalamus and brainstem causes nausea and vomiting. And the stimulation of serotonin 3 and 5 results in an increased GI motility and GI cramps, which can lead to diarrhea. The central nervous system effects at the basal ganglia, and it's mediated by the serotonin 5 receptors stimulation. The stimulation at the basal ganglia by these receptors can cause psychomotor retardation and Parkinson's disease. With the mental side effects, the stimulation of the serotonin 5 and 2 receptors can lead to mental agitation, anxiety, and panic attacks. And then with the sexual dysfunction, patients may complain about low libido and erectile dysfunction. And the role of the nurse in the safe administration and monitoring of the SSRIs, every RN is legally responsible for the correct administration of drugs, and this includes the 5 rights. These are the right patient, the right drug, the right dose, the right route, and the right time. The nurses should check if patient has known allergies and if they react to any of the previous drugs administered. And also the nurse should monitor the effect of drugs that are administered and take regular blood tests to ensure levels of the serotonin are in the normal range. The nurse should constantly check if patients' moods are improving, if they're constant or if they're decreasing. And if there's any changes in the moods, the doses should change accordingly, or they should notify the doctors of any changes in their condition. Thank you.